Well, India has announced limited exports of the anti-malarial drug hydroxychloroquine, which can be used to treat severe cases of COVID-19 under strict medical supervision. This announcement came hours after a public threat of retaliation by President Trump. Only 3 days ago, India had announced a blanket ban on the export of the drug. In fact, even before that, on the 25th of March, exports had been restricted. President Trump had then requested Prime Minister Modi over the phone to change his mind on Saturday. Well, Shashi Tharoor, Lok Sabha MP, leader of the Congress party, joining us on NDTV this evening. Shashi Tharoor, how do you see this entire controversy with Trump play out? To be fair, India had already taken the decision to lift these restrictions on the export of this drug before he made this rather strange threat.
Well, if that's true, we didn't know that because we certainly haven't heard that at all at any stage from the government. All I know is that what Mr. Trump did was appallingly discourteous. We have never seen a head of state or government openly threatening the head of state or government of a friendly country in this disgraceful manner. What he said was essentially saying, you do this or else. And to do that in a public way, but it's bad enough if he did it in a private conversation with the Prime Minister, but to do it in a public way like this, I think created enormous feeling of unpleasantness all around from anyone watching it in India. And then the announcement of the decision comes at a time when everyone is concerned about a lack of adequate equipment, personal protective equipment for our healthcare workers, and adequate test kits and possibly adequate medicines. Now, if indeed hydroxychloroquine is needed by a large percentage of our population, do we have enough supplies? A week ago in Thiruvananthapuram, there was absolutely no stock available. Today, somebody tweeted from Jaipur saying there is no stock available in any medical store. So we are still ramping up manufacturing for the Indian consumption of our people who should be the first priority of the Indian government. In these circumstances, I think we're legitimately concerned. When Mr. Trump talks about releasing our supply, it's not his supply until we decide we have enough to spare to sell it to him. And somehow the caving in on the same day, I'm afraid, left a pretty bad taste in people's mouths.
Well, just to be the devil's advocate here, Shashi Tharoor, I think people have said a couple of things. One is that Donald Trump has a certain way with words. He's annoyed the best of his allies with what he's said over the years. But two, that we are an important strategic partner of the United States and that it would have been short-sighted for India to have overlooked this request because, you know, we also would need them. In this fight against COVID-19. So you've been a diplomat too. I'm asking you from that perspective as well, that wasn't it better for India to have lifted this restriction? Maybe it shouldn't have been announced in the first place because it was announced only a couple of days ago.
So that's the other question. When did Mr. Trump convey to Mr. Modi before Sunday that he was interested? He mentioned Sunday in his press conference. Today we are Tuesday. And in his press conference, he said he spoke to Mr. Modi on Sunday. But the fact is that our announcement preceded that conversation. And therefore, clearly, we had no idea that the Americans were counting on us for vast quantities of hydroxychloride before that. If Mr. Trump had asked Mr. Modi privately before, then Mr. Modi should have told him, let me find a way of meeting this. You're quite right, Nidhi. There are strategic reasons why we might want to satisfy the Americans. He could have told him, don't make a public issue. We'll work something out. Let's see what we can do. We're going to ramp up production. As long as I can meet the basic domestic demand, we'll take care of you. Don't worry about it. But once Mr. Trump made this, as I said, disgraceful public statement, it puts Mr. Modi and India in a humiliating light. To see the government of India essentially doing a U-turn on a proclaimed policy without any forewarning other than a blatant and crude threat by a partner state which has been so incredibly ungracious, that does not reflect well either on India as a credible member state in the international community or on the quality of
well,
our
it was
relationship.
certainly ungracious. You're absolutely right. It was definitely ungracious. But there is a bigger concern you have raised, which is about whether, we have enough quantity of the drug ourselves. Thank you, Shashi Tharoor, because I'm going to ask that question to Mahesh Doshi, the National President of the Indian Drug Manufacturers Association. We have Dr. Romil Tikku, Associate Director of Internal Medicine at Max Healthcare, and Nirupama Rao, India's former Foreign Secretary, has also been our ambassador to the United States. I'll be going to her first, actually. Ma'am, your take on Shashi Tharoor was also wearing his former diplomat's hat, just saying how this really sort of was a very ungracious comment by the US president. How do you see this and India's decision, therefore, to lift these restrictions on the export of this drug?
Well, I think just as they compare the whole global situation surrounding COVID-19 almost to being like a warlike situation, there is a certain fog of war that has descended on all aspects of the debate on issues, especially when they concern the supply of essential drugs and treatment and the number of cases and testing and what have you. I saw the video of the press statement made by President Trump, and the question that was asked of him was a pretty convoluted question. I don't know to what extent the person asking the question really had a fix on the actual situation concerning the supply of hydrochloroquine by India to the United States. The fact is that, from what I understand, the United States had contracted for a certain supply of this drug from India, and this was way before the ban was announced.
Yes,
or the
they
export
had made
ban
some
was
advance
announced,
payment as well.
and made advance payment as well. So what I believe has been agreed to is the release of this consignment, which had been paid for. Subsequently, of course, in early April, the government of India had announced controls on the export of hydrochloroquine and paracetamol. I think both of these drugs have been placed today under the licensed category. And the government will take a decision on the release of these drugs for export on a case-by-case basis. The situation would obviously be monitored based on what the national requirement is, because it is really the responsibility and the duty of every government to first provide for its own citizens before it's able to export.
You're absolutely right.
Drugs which are under such control.
It doesn't explain why the government announced a complete blanket ban just 3 days ago and then suddenly reversed that policy 48 hours later after the Trump-Modi phone call. So I think that's why questions are being raised about the sequence of events and as they have played out. But I want to ask Mr. Doshi, because he heads the Indian Drug Manufacturers Association. Mr. Doshi, do we have enough medication here? Do we have enough of this drug here in India? Are our requirements met?
Good evening, Nidhi. First of all, I wish good health and safe health to our all viewers of the NDTV. Secondly, we have enough of stock is available with us. We have told government is doing a daily situation observation and taking data from us. Major two company like a Kedila Zydus and a Ipca, they both have a capacity to produce 40 to 45 metric ton of the HCQ, and out of that they can produce 20 crores of tablet per month. And the government of India is at present come out with that they have to create the buffer stock of the 10 crores tablets, so that 10 crore tablets will be go into the buffer stock. After that also, whatever the countries needed the additional medicine, so Indian pharmaceutical industry is capable to provide all that. Apart that, we have excess production also. We have excess capacity also. Government is taking a daily stock from us, and we are providing them the data. Whatever the material is lying with us, how much we can produce, how much program for the next one. So this month, the 20 crore tablet from the 2 units, and the same 2 unit will produce another 25 crore tablets in the next month. So according to us, country has enough stock, and if government after reviewing the situation will allow to do the export to the pharmaceutical company, then it's a very easy breath for us.
Well, I'm glad to know that at least, our requirements, you're saying, will be taken care of, and you're saying there's excess stock. That one doesn't understand why there was a blanket ban announced a couple of days ago. But Dr. Romil Tikku, just to ask you, There's a debate about the drug itself, about HCQ and how effective it actually is. Now, President Trump called it a game changer. But from what I understand, doctors all over the world are actually cautioning against treating this drug as some kind of a cure. Can you elaborate on that?
I won't call it a game changer. Whatever evidence we have till now is all anecdotal. See, whatever French studies or Chinese studies have been done till now, they are showing that it's effective, but then there are certain studies which show it is not effective. So we need more data on this. We need more trials, but we don't have time since we are losing lives and it's spreading all over the world. On case-to-case basis, I would say in exceptional circumstances, in critical patients who are hospitalized, it can be used. We can't use it for mild to moderate cases because it has its toxicity. And you have to take the family into confidence and then use it. The trials have shown that it's effective, but I don't think there is enough evidence for us to say this is the drug. And we have to use it with caution in elderly also and in children because it can cause cardiac toxicity, it can cause retinopathy, it can cause GI disturbances, it can cause bone marrow suppression. There are reports of toxicity, there are reports of death also. So I can't say that everyone has to use it. Even when it comes to prophylaxis, not everyone has to take it. There has been a lot of hoarding when the reports came in that it is useful. A lot of people have hoarded it. It's not available now. It's not supposed to be sold over the counter, but it's not there for healthcare workers. For prophylaxis also, it's for only two categories of population. For healthcare workers who are asymptomatic and who are involved in the care of suspected or proven COVID patients. Or it's meant for household contacts of
So you're saying no one should self-medicate. You're saying nobody should self-medicate and try to take these drugs on their own, thinking that it's because there are cases in other parts of the world where people have done that after Trump, said it at a press conference, and there were dangerous consequences.
Well, not at all. I would say we should not do it, especially the elderly. In diabetics, it can cause hypoglycemia. In cardiac patients, there can be other issues, arrhythmias. It prolongs the QT interval. Even the French health minister said that they warn against the use of this drug in COVID patients. They said it should be used only in exceptional circumstances in critical patients because of its toxicity. So how can we endorse and say that this is the drug and this will take care of it? But having said that, since we don't have a specific drug against it, against COVID-19, in certain cases, case-to-case basis, we can start it and we can see the results. But again, it's all anecdotal. We need more trials, we need more evidence, but we can't wait for the conclusion of those trials since we are running short of time. And with the increasing number of cases, it is being used all over the world right now with whatever evidence we have till now, because there's no other
I just wanted to ask you one more question, Dr. Tikku, because we had the Delhi Health Minister at on the beginning of the show, and he gave us an interesting statistic that in Delhi, where you work, 523 people admitted in hospital for COVID-19, but only 8 people on ventilator support. How important is that figure? Just the very fact that very few people at the moment are on ventilator support, is that a good sign?
That's a very good sign, I would say. Compared to the American and European population, there has been huge mortality, especially in Italy and even America. Though they have less mortality, there are huge number of cases. But yes, we do have less number of patients in the ICU, less number of patients on ventilators. That's because, again, we don't have too much of an elderly population. India is a young country, and whatever gene sequencing has been done till now, it has shown that there's a single mutation in the virus that we have seen here, and that might be less virulent. I don't know how much we can go with that, but still, again, the theory of the TB, BCG vaccine and malaria, but overall it seems to be less virulent in India, and that's a very positive thing. Again, in children, it doesn't give you too many complications, though the numbers, we have huge numbers in 20 to 40 age group, but we don't have too many complications. Even the mortality which we have is in the 60 and above age group, and we don't have too much of mortality. If you look at our country with the kind of population we have and the healthcare facilities we have, I mean, compared to America, which has like 34 beds per 1 lakh population, we have 2 beds, and we are still doing well.
Well,
at the same time,
fingers crossed that it stays that way. Fingers crossed that it stays that way.
We have to applaud our government that they took the right decision at the right time. We just have to follow whatever instructions are being given, and the healthcare workers are doing their best.
Nirupama Rao, just one last question on in terms of how countries can collaborate. We saw the Prime Minister take the lead on having a G20 video conference. He reached out to SAARC countries before that. But, given what we've seen over the last 24 hours with this whole issue over the Trump's use of words. Also, I mean, Trump himself has banned the export of masks from the United States, and Canada has got upset about that. Other countries, Germany has been upset with the way the US is handling all of this. So, I mean, in terms of international collaboration, how important is that going to be at this time?
I think international collaboration is extremely important, but countries which are facing the pandemic and are dealing with crisis situations, obviously the first instinct is to kind of, cover, literally circle the wagons, roll up the drawbridge, and look at just national solutions for the crisis they're facing. So in that sense, people have been talking about the world order as we've seen it, this hyper-globalization as we've seen it, being somewhat upended by the situation that we face. But in the long term, in order to deal with such pandemics and the threat of biological threats of this nature, diseases of this nature, there is no other solution but for us to collaborate internationally in terms of vaccine development, in terms of sequencing of the genome of such, the viruses that threaten us, in terms of not introducing too many protective trade restrictions that prevent the supply chains of vital medical equipment from being sent where it is needed. Obviously,
right.
Nations will take the decision to supply their own needs first, but I think in the ultimate analysis, there is no other alternative but to collaborate internationally, because this is a threat that faces humanity as a whole.
Thank you very much to all of you for joining us this evening on that particular aspect of the story. Let's hope that, as Dr. Tikku says, that the trajectory for India stays the way that it is at the moment, and it does not turn out to be as bad as many other countries. Thanks very much.